Hello.
Hello,
What's your name?
Christelle.
What's what happened?
Um, basically, I was trying to block a goal. I'm a
Okay.
goalie, and I was trying to use two hands, but my left hand missed the ball, and
Okay.
my thumb got pushed back too far.
Your thumb got pushed back too
Yes.
far?
Yes.
Okay. What part of your thumb hurts the most? Like if you were to point to one spot with one finger, where the most pain is at?
Over here.
Right there?
Yes.
Okay. When the ball hits your thumb, do you hear any like cracking or popping at all?
I didn't.
No. Any like numbers or tingling? Can you feel your thumb?
I can feel it.
You can
It
feel
just hurts a lot.
It just hurts?
Mhm.
Okay. Have you ever hurt your thumb before or your wrist or anything?
No, I only hurt the fingers before, but
Just from like being a goalie and
yes.
stuff like that. Okay. On a scale of 1 to 10, 10 being the worst pain you've ever felt before, what would you describe your pain as right now?
I would describe it as a 5.
A 5? And so, did this just happen like right now or previous?
Yes, it actually did. Our game is still going on right now, but it happened like close to the beginning of the game.
Okay, you still kept playing through some of it until it was just too bad, or?
I played like a couple more plays, but then I had to get switched out because it just hurt so badly.
Okay. Is there like a position that you like that feels better for your thumb being or worse? Like what hurts the most when you're with your thumb?
It hurts when my thumb is pushed back.
Pushed
more.
back?
Yeah, it hurts like kind of all directions, but it hurts like the worst when my thumb is pushed back. So I just like to keep it kind of neutral.
Okay, so is that like the best, like, do you feel like better at that position? Okay. So if it's okay, I'm gonna start palpating around and trying to see what kind of things are in here. I'm gonna start here, see if there's anything. Carpal pain, nothing there?
No,
No.
it's more closer to my
Close your thumb, nothing in your fingers, right? Like,
nothing in my fingers.
okay. So go ahead and work over there.
Yeah, as you get closer and closer, I can feel it more.
Right here? Anything up here?
Not too much.
No? Okay. Cool. So if you it's okay with you, I want you to try and do some thumb motions.
Okay.
So I want you to try and bring your thumb up and bring it like this, bring it down. Any pain with those so far?
Down doesn't hurt. Up hurts a little bit more.
Up hurts a little more? Okay, how about bringing your thumb closer to your fingers? How does that feel?
That feels good.
How about out here, trying to pull it out more?
That hurts.
That hurts a lot? Okay. So I'm gonna try and do the motions for you, try and relax a little bit.
Wrist is good.
Anything there?
That hurts.
That hurts still? Okay. So I'm gonna go ahead and resist a little bit. So I want you to try and extend your thumb up. So I'm gonna hold down here. Go ahead. Does that hurt?
Yes.
Same motion. Okay. And now go ahead and push down. Does that hurt?
No, not that much.
Okay. How about going up?
Going up hurts more.
Hurts more?
Yeah, that
How
one.
about bringing your thumb close to your fingers? How about that?
No, not as bad.
So the worst one's going out here.
Yes, going out. Up hurts a little bit too.
After those two? Okay. So observing it so far, I see a little bit of palpation. I felt some tenderness and some pain around that MCP joint, the metacarpal phalangeal joint, and so maybe a possible like something's wrong with there, like maybe like some kind of like fracture, maybe. Although there's no pops and no cracks, so that rules that out pretty much. I may still test for that, but with that, I maybe could think of maybe it's like a ligament, maybe UCL. So maybe check that out. A little bit of swelling, some edema, some ecchymosis. So with that observation, I'm gonna try and do some special tests. I'm going to do some valgus and varus tests on the metacarpal phalangeal joint as well as the distal phalangeal joint, and maybe check for anything there. So put it right here. stabilize that and move it. I'm gonna do valgus first, so bringing this closer to you, close to the fingers. Does that hurt?
Not that much.
How about out here?
Yes.
Yes. Okay.
More.
More out there.
Mm-hmm.
Okay. How about distal? Oh, in here?
There's not that much pain.
Both ways? No?
Mm.
Okay.
It's more closer to the beginning of my thumb.
Yeah.
Mm-hmm.
Okay. So that was a positive valgus test for the thumb. Due to the positive test, I want to splint and refer to a physician to try and see what kind of, because it could be a possible UCL sprain, what we call that gamekeeper's thumb as well. Get that checked. See what we need to do for this moment now. To treat it, I'd probably do some rice, so some resting that thumb a little bit, icing it, keeping compression, elevating it if possible, which might be hard for a thumb, but trying to get that blood flow away, and going to send a physician. If there is a possible sprain there and we have to brace it, then keep the brace on and still continue ricing it with the compression and the ice. And after that, maybe try and see what kind of exercises we can do later on to strengthen it, get it back to return to play, to get it back to playing as a goalkeeper. So, any questions for me?
No.
Okay.